We have a veritable American flag up here today. I love it, red, white, and blue. But we're here not just to talk about America, we're here to talk about global health inequity. And I'm simply delighted to be among such an incredible group of women, of clinicians, of researchers. I want to start by defining health equity. So if you could each briefly just explain to us, what does health equity mean to you?
Well, I think of health equity as every individual person having the opportunity to reach their highest health potential. And as a physician, as an emergency medicine physician, I think that is what I want for every single one of my patients, and that motivates me to do the work that I do.
Thank you. Helle.
When I think about health equity, I always think about that tree, the fruit tree that's leaning. Maybe some of you have seen this metaphor. Imagine a fruit tree that's leaning, and you have two people reaching for fruit. Someone is able to reach the fruit more easily than the other person. Health equity is making sure they have custom tools. So one person has a taller ladder than the other person so they can reach the same amount of fruit. But hopefully we also talk today about justice, which is when you actually fix the fruit tree so everyone can access the fruit that they need.
And for me, health equity is about the fact that people, regardless of where they live, their socioeconomic class, their race, their sexual orientation, should all have equal access to care. And that includes 80% of the world's population living in low and middle income countries.
So I want to turn the conversation to an acronym that has come under a lot of scrutiny lately, and that acronym is DEI. There was a period of time where DEI was all the rage and everybody wanted to have some effort that was advancing DEI, and in recent times it has actually come under some scrutiny and has seen a lot of critics. How do you think the state of DEI today is affecting the work that you do? Maybe I'll start with you, Dr. Blackstock.
Well, yeah, I mean, it's very personal for me. So for some of you who don't know me, I left a career in academic medicine because I felt that, as a DEI leader, I could not do the work authentically, the way that I really wanted to do it. And I left and I founded Advancing Health Equity. We're working with healthcare organizations to create more diverse, inclusive workforces, because we know ultimately that trickles down onto the care that we provide our patients. And so I would say, like, the SCOTUS decision of last year as it relates to admissions to higher education, there was a federal piece of legislation called the Educate Act that specifically targeted DEI in medical education, that said that if medical schools were going to have DEI programs, that would lead to them not receiving federal funds. To me, that means, like, we're in a crisis, because we're talking about some of the most horrible statistics now as they relate to health equity, and then we're trying to reverse decades of advances within medicine or within healthcare. So that is very scary to me.
It is a terrifying prospect. Helle, how are you seeing that impact the work you're doing, in particular on the clinical research side?
Absolutely. Well, I can say DEI leaders didn't sign up for performative DEI. They want material change, and they want to be empowered to do that. In my work in oncology clinical trials, I'm really focused on how do we advance access to research. We recognize that not only does that have immediate benefit for patients, but certainly has a long tail benefit. And in order to do that, you really need to think about the social conditions, the social determinants of health. We heard a lot about social determinants of health earlier with the Centene conversation. You really need to think about the conditions in which patients live in order to make true transformation. And DEI leaders are tasked with thinking about that and are able to make transformation if they have the power and the authority to do so.
Jay, we've talked a lot about sort of the headwinds here in the US, but it's a whole nother ballgame when we're talking about global population health. What similarities or differences do you see in the context of the work that you do?
So in the context of the work that I do, I mean, we're in the business of making sure that the pharmaceutical industry is inclusive in their business, to make sure that their products are reaching patients all around the world. Specifically looking at 100 low and middle income countries. So if you believe in DEI principles, not only must your governance model and equal pay be afforded to headquarter and the C-level executives around the world, but that needs to be available for also their businesses in low and middle income countries. So that means we look specifically at sort of governance models for the companies themselves, how they improve access in low and middle income countries. Do they actually reach different populations, including vulnerable populations all around the world? And finally, is that done in an equitable and a fair way? So I think that has been extremely transformative. And as an employer myself, I think, and as a woman of color myself, I think for us, it is really important that when we're dealing with stakeholders who are engaged in driving and empowering industry to do better, that is a diverse group that is brought forward to make that change itself. And you especially see that in certain sectors of the healthcare industry, like in medical oxygen that we evaluate. The medical gas companies are very male-driven industries. And now, they're really trying to make a big effort in making sure that it's more diverse and more inclusive of the different populations around the world.
It seems to me that there's a damning amount of evidence pointing to the importance of diversity in clinical care providers. In fact, there was just an article a few days ago in JAMA that was looking at the impact on women's health, in particular with women care providers. There is all sorts of data out there showing that impact as well from a racial perspective. And yet, there are so many forces that are preventing those changes from happening. How do you take on some of these headwinds?
Yeah, I mean, there's even a study, I have to say, there's even a study from last year from the Journal of American Medical Association that showed that one US county, they had one Black primary care physician that improved life expectancy for Black people living in that county and actually everyone else.
That's incredible.
I know, so people underestimate the impact and the importance of diversity. I will say that, just like Hala said, many of us that are doing this work, it means very, very much to us, right? We are working against practices and policies that are centuries old. Like one thing I wrote about was the Flexner report, and that's a report that closed medical schools at the turn of the 20th century. It closed 5 out of 7 of the Black medical schools, leading us to lose between 25 and 35,000 Black physicians. So one part is understanding that today in 2024, why we may see these dismal numbers, part of it is because of the history. So understanding that history, understanding how other policy changes can improve or hinder the statistics that we see now, and working with the communities that need to be centered. So I always say a lot of the answers as they relate to health equity and DEI really lie within the communities we serve. Our patients, our community members, they can tell us what needs to be fixed. We just need to listen to them. So I really would call on folks in this room to really interact with the communities that you're serving. I love that I heard so much about social determinants of health on this stage, because that's what we've been talking about for a long time. Maybe not in this room, but we've been talking about it as it relates to health for a very long time. And we know that those are the key drivers of what leads to good health.
Absolutely. And like Uché, Hala, you left a career in academic medicine to start a company, actually, taking on this problem. Why do you believe that a tech company is the solution to advancing precision medicine?
Yeah, so I realized that this was a hum in the back of my mind that I just needed to react to, and I felt that in some way, my academic career, I was incrementally making progress, but I wanted to make impact now. And the moment was now, and the opportunity was now. As an academic oncologist, I was seeing a few patients a day and committing the rest of my time to science, and there was an evidence base for how can we actually move the needle on recruiting diverse patients, making sure we're expanding access, and our model is really focused on going to the provider. 77% of patients that enroll in an oncology trial do so because of a provider recommendation. So the question I started asking are, who are the providers that are offering trials and who are not, and why aren't they? And so we started thinking about, let's address the pain points that they experience in their clinic, and let's ensure that we can give them an opportunity to easily offer trials to patients. And this led me to conversations with oncologists all around the United States, and I frequently ask a community oncologist, how many patients do you see today? And they'll say, 40 patients. And so that's just a number, but I want you all who aren't healthcare providers to think in your chair. Imagine a day where you have 40 meetings, and for every meeting, you need to make a decision. And you also need to document the data you collected to make that decision, and also the justification for that decision. And you have to follow up for all the meetings you had the day before. That's the reality of a healthcare provider in the community serving diverse patients that we want to have enroll patients to trials. So of course, they're struggling. And so technology has a role. Of course, there's other innovation that needs to be at play, and that's what I get the pleasure of addressing every day.
In just a moment, we're going to turn to you all in the audience for questions. So raise your hand and a mic will come your way. But Jay, before we do that, what role does global pharma play in all of this?
Well, at the end, global pharma is responsible for developing and delivering the medicines that we all need in order to treat the conditions that we have and prevent the diseases that we have. So, and global pharma plays a very strong upstream role. If some of the biggest companies in the world can make sure that their business is more sustainable, more inclusive, more serving 80% of the world's population in a fair and equal way, then they can make a huge impact. So one of the things that we really push for is that investors who invest in the pharmaceutical industry also need to invest differently. So we actually host the largest signatory base of investors in healthcare in the world, with about 140 investment firms that sign on to the principles of our work and invest differently in the pharmaceutical industry. So their shareholder resolutions are basically trying to convince companies or demand that companies need to expand the broader reach of their products for patients all around the world, make sure that their clinical studies are inclusive, diverse, and around the whole world, and make sure that the products are registered and delivered in the world in an affordable way. So that is the kind of transformative work that you need to do in order to convince some of the biggest companies in the world to move.
Over to the audience now. I think I saw a hand being raised earlier. Any questions from the audience? Yes.
Hi, Joe Harrison, founder and CEO of Avail Health. I just wanted to comment as a white man. I was lucky that I started unlearning and continue to racism, classism, et cetera, at a very young age. And I'm just thinking about the powerful positions and who's seating in those positions. And I just wanted to ask for comments on, what are you seeing in terms of, minds changing, outlooks changing, understanding, like learning, that I think has such an impact. If it happens, I have no line of sight on that, and I'm wondering what your experience is in the roles you're in.
It's a great question.
Yeah, I think that's a great question. And I think in the work that I do with advancing health equity, we're working with a lot of organizations who already have buy-in from leadership. But we always see that that's the key to success. Like the leaders who truly believe in the importance of equity and that look at every decision that they make or every part of their strategy through an equity lens, like those are going to be the ones that really care deeply about what their workplaces look like what is the culture of their workplaces, how does that associate with how care is delivered, and so we probably have a selection bias in who decides to work with us, and obviously we would want more leaders to be deeply concerned about the same issues, but I think it's a matter of life and death. We see people, and we took overall, Americans are not living long lives, right? Life expectancy continues to go down for every racial demographic, especially people of color. And so really, I think everyone in health needs to be committed to improving these outcomes.
Another question over here, yes.
Hi, Anil Mena. I'm a Chief Medical Officer with Simpler. I'm a Hispanic internist in background. Very proud to work for a company that's very strong in DEI. But as an internist, I think one of the things that you mentioned was that the paper that was published that showed difference in outcomes based on the concordance of the care that's delivered. I think that's what the voice should be about, the science behind it, the evidence that providing care in that concordance can improve outcomes. My question to you all is, how do we raise that voice to our corporate level to make it less corporate and more about the medicine that we're delivering?
I can take that. So I think there's a couple of solutions to it, right? There needs to be quite a strong strategic embedding of what it means to be an organization or a company that is delivering in a diverse and equitable way. And that comes really from the top, but it cannot just live at the top. It needs to be really embedded in the system. And one of the accountability tools that we use is to measure that over time to see whether there is progress being made on any organization over time. There's the CEO's bonus structure is that associated with performance and access to medicine globally? Is there, and other firms obviously look at diversity and inclusion parameters at the leadership level and across the company. A metric, there's also a metric on clinical trial diversity on top of the ethical components to it. So to me, I think it's really important as a company to have a very strong policy in place that is actually implemented globally. It's also really important that today's workforce demands that the leadership and a company's philosophy is really breathed through its business itself. And for us, we find a lot of power in internal change makers within any firms that really drive that change. And then external pressure. I mean, right now, at least in the pharmaceutical industry is filling a gap in education systems and in healthcare systems by also supporting using funding. And when their primary work is delivering on the medicines itself. So keeping the focus to make sure that the primary role of a company is in delivery, I think it's important to maintain, and then additions to that can be added on. So a strong accountability mechanism needs to be paired with sort of an overarching strategy.
Thank you. Well, we're almost at that time, so I'm just going to do a quick fire round, so 10 seconds each, and I'll start with this question. Was COVID an accelerant of DEI in healthcare, or did it slow things down? 10 seconds.
I would say accelerant. I think it exposed the deep fissures within our healthcare system. Many of us knew what those fissures were, but I think to a more general audience, it exposed them in a way that had never been exposed before.
Yeah, I agree. I think it emboldened organizations to talk about DEI when they weren't interested or had the bandwidth to do so before. But I think now is sort of the time of reckoning where they're starting to define what it means and how they can consistently apply it within the organization.
Jay?
So health equity has been an issue that's a chronic issue for time immemorial already. So COVID basically accelerated the understanding of the situation and the barriers behind it, but not a lot has changed in terms of are people still receiving care really at scale across the world. So there's still a lot of work to do, but it can be done. And there are fantastic models out there on how this can be done, real life-tested methods out there. So it's about scaling that up.
Excellent. Well, you're saved by the bell. I had another fire round of questions, but we're at time right now. So thank you all for a fantastic discussion.